Good afternoon and welcome to the September 2023 Pitt County DSS Board of Directors meeting. I would like to call the meeting to order. I would like to first start by observing a moment of silence. Thank you. Do we have any public comments?
Yes, sir.
Thank you. Okay, I would like to adopt or revise today's agenda.
Move approval. Second.
All right. Do we have any changes to last month's meeting minutes?
So
Nope.
moved.
Can I just second?
Second.
All right, this time we're going to have recognition of hires and retirees.
Good afternoon, everyone. As I call your name, if you could, I'll leave you to last, Nikki. If you could step up to the podium and speak into the microphone, we would just like to take this opportunity to get to know you. So your name, a little bit of information about your background, and anything else that you think would be important for us to know about you. So the first person is Shamika Mitchell. Shamika, can you come to the...
Don't be shy. Get some pep in that step.
Hello,
Hi.
my name is Shamika Mitchell, and
Wait a minute, I
I'm
think
an
we have a
accountant
microphone problem.
Oh.
The microphone is down, and I don't see that well.
Can you hear me now?
Now,
Okay, my name is Shamika Mitchell, and I'm accounting tech too. What else would you like to know?
Where are you from?
Fountain,
Okay, Pitt County here.
Pitt
Okay.
County, yes, sir.
Well, welcome.
Welcome.
We're glad
Thank
you're
you.
here.
Thank you.
Glad to have you to the ship.
Thank you.
Okay, Victoria Ashley Phelps. And do you like to go by Ashley?
Yes.
Okay.
Ashley. Ashley.
Welcome, Ashley.
Thank you. So I'm Victoria Ashley Myers Phelps, but I go by Ashley. I'm from Washington County, from Plymouth, and I have 2 years of CPS background, and I'm the new intake worker for CPS here. And I'm very excited, and I have already enjoyed it so much already. And my husband is a clerk of court in Washington County, so, yep.
Well, nice to have you. Welcome
Thank
to
you.
the social service ship.
Thank you. Thank you.
Thank you.
Thank you
Welcome
so much.
Thanks,
aboard.
Thank
Ashley.
you.
Olivia Contreras.
I think she's here.
Is she
No?
here?
I
Okay.
think she had a medical issue.
Dantisha Smith.
Did you say Katisha?
Dantisha.
Gontisha.
I'm sorry, D-O-N.
Oh, Dontisha. Okay.
Hello, my name is Dantisha Smith. I'm from Ahoskie. I'm in the process of moving over here.
Ooh.
I'm doing long-term care here, and I was working at Berkeley County Social Services for over 7 years. Looking forward to a change, and I wanted something different, so I'm looking forward to it.
Well, welcome,
Thank
Dantisha.
you.
Welcome
you.
to the
Welcome.
social service ship from Ahoskie. Short sail.
Okay, that's it for our new hires.
One more.
Oh, we do? Oh, well, she's going to have the floor in just a minute. She's going to have her own Nikki Mears show in just a minute or two.
Stacy Keach.
Oh,
Hey,
Stacy.
Stacy, welcome.
Hi, my name is Stacy Keach. I'm originally from Washington, North Carolina, Little Washington as they call it. I was employed with Pitt County Tax, and I have a bachelor's degree in social work. Been trying to get in social work for a while now, and fortunately I was hired with adult Medicaid. I was in the Marine Corps for 4 years.
Thank
Thank
you
you for your service.
Thank you. Always a Marine. I have a son who recently moved to Texas, who I miss so dearly. I cannot wait to get into this field, and I'm just glad to be here. And I'm so excited. Thank you.
We're glad to have you.
Thank you.
Thank
Welcome
you.
to the social service ship. I'm happy you bring good sales.
Thank you, Stacy. I'm a retired Navy chief.
Oh.
All right, the new hires can
Thank you
be.
for your service too. I didn't know that.
Thank you. The new hires can be dismissed, or you're welcome to stay.
Okay, Brian.
Okay, we don't, Nikki or Liz. Okay,
Yeah.
next, we're gonna have items for report. Brian?
Good afternoon.
Good afternoon, Mr. Avery.
Today, I'm going to cover our applications in the Food and Nutrition Services Program and the Medicaid programs. And I'm also going to give another update on where we are with Medicaid expansion. This is sort of an overview of the FNS applications, Food and Nutrition Services, since September of 2022. The numbers were fairly consistent in most months, except you'll notice in May, we had a large increase there of 1,663 applications. Then it leveled back off to the 1,400 to 1,500 range, and then in August, we had almost 1,800 applications. On the left of that chart, you see the timeliness figures. The state's requirement for Food and Nutrition Services applications is 95% timely. And it shows the regular and the expedited percentages. And in July, we did meet the 95% for the regular category. And we met the expedited category of 95% for August. So regular in July was at 95%. We were at 90% for August. And a lot of this has to do with the fluctuation in these timeliness percentages has to do with the volume that's being received. And it sort of fits for August, the large number that was received in August. We did not maintain the 95%. But I will have to say the staff are doing an excellent job. Look at the right column, the number of applications processed by the staff, almost 1,700 processed in August. And we've come a long way rebuilding because we did have a lot of vacancies in that area. And we are close to regaining some consistency in our timeliness figures.
How many staffers do you have in this?
In Food and Nutrition Services, we have 11 that do intake, 11 applications, 11 that do applications. And then there are 3 in the redetermination unit that also do the late recertifications, which are also considered applications. A late recertification is when a client turns in the recert form in the month after that recertification is due. So at that point, it's an application. So we have 14 staff members working on this. At this point in time, we have 1 vacancy in the FNS intake area that we're working on filling.
And your irregular means, and the difference in your regular and an expeditious,
Okay, I'll explain that.
that'll be nice for all of us.
Regular
Me and the
applications, there's a 30-day processing time frame standard. What makes an application expedited is if a client's income does not meet the client's housing and utility monthly needs. So when they do the application or they turn the recertification in, if the monthly income they're receiving is below what it takes for their basic household expenses, then it becomes an expedited application, and we have to have a decision on the application 4 days from the date of the application. So that's the expedited
I
group.
mean that they don't get it, or, I
Means-
was thinking expedited, meaning that it's put right through.
Well, they don't get it the same day, no, but by day 4, a decision has to be made on the application. And then after that, they would be able to access it on their EBT card.
All right, thank you.
Oh, you're welcome. So taking a look at the Medicaid applications, the state standard for Medicaid processing time is 90% timely. And in June, we met the state standard at 91% in the MAD and the other categories. MAD is the disability applications, other is all other Medicaid programs. In July, we were at 89%, slightly below the 90% required for MAD. The other category, we were at 93%. And then August, 96% for the disability applications and 92% for the other applications, all other Medicaid applications. And this is commendable as well, because some of the Medicaid applications can be very complicated. And sometimes a Medicaid application will take more time depending on the level of complexity than some other applications that could be received. We can note on those, we've been sort of keeping a running record of how many are past due at the end of the month. And you can see by that right column, that number is going down, so we're making progress there. We have, in intake for Medicaid, we have 16 in-house caseworkers that do family and children's and adult Medicaid applications. We have 2 positions that are outpost at the ECU School of Medicine, and we have 4 that are outpost at the ECU Medical Center, the actual hospital. We have 1 outpost position vacant at the School of Medicine. We have 1 in-house in Family and Children's Medicaid and 1 in-house in Adult Medicaid for intake. Those are the vacancies we have right now in the area of Medicaid. So I'll be happy to answer any questions you have about these figures.
Now, the vacancies you're talking about is a vacancy in the employees,
Correct. That's correct. That's correct.
but doesn't it take a time to fill that once they apply?
It does. We are getting some people that, like, we had 2 that came in last month in intake. Both of them had prior experience in adult Medicaid. So that was a good, that puts you ahead when they've already done the program in another county. Then there are some that are coming in that we actually train from the ground up in Medicaid policy. And I will say that we are seeing a larger number of applications for our income maintenance positions than we had previously. That number has gone up recently, so that's a good sign too. We have a larger pool of applicants.
What is the impact when the state legislature doesn't pass that Medicaid expansion in a timely fashion as it relates to the impact on the families?
Okay,
I like for the public
I'm
to
glad
know
you
that.
asked that, because that's gonna be my next next subject area we're gonna
Make sure
discuss.
you point that
That's the
out.
next slide. I will.
Thank you.
Sure. Okay, now we're gonna do a little update on Medicaid expansion. We talked a little bit about it last month. What we know as of today, what is scheduled for tomorrow and Thursday is the General Assembly will be voting. That's the last I read, that they're gonna be voting tomorrow.
You reckon?
Well, that's the latest, but that could, we don't know for sure, but that's in the news. And they have decoupled the Medicaid expansion and the gaming legislation from the state budget. So they're gonna vote on the state budget, as one vote. That's what's planned at this point right now, what I've read. And then the other vote will be to vote on the Medicaid expansion piece and the gaming legislation as one package, one vote. So that's what's set for Wednesday and Thursday. We expect, based on a state projection, that Pitt County will have about 12,866 individuals in the first 2 years of implementation that will be eligible or potentially eligible to receive full Medicaid.
How many, 12,000?
12,866, that's the state projection. What is changing about the policy, once Medicaid expansion is implemented, the disability requirement is being eliminated. And the reason that this is so important is individuals aged 19 through 64, in order to receive Medicaid, have had to meet the disability requirement. So that means that even though you may be dealing with a chronic health issue like hypertension or diabetes and need to be seen and need to be followed for treatment and have that monitored, Medicaid was not an option because there are people working that have hypertension, diabetes, they can work, but they don't meet the disability requirement. So the disability requirement is being eliminated. So people in those age groups, that's been one barrier to people participating. Also, the income limits are being raised for full Medicaid coverage from 100% of the federal poverty level to 133% of the federal poverty level. And I've got those figures on the chart. This will mainly apply to either a single individual or a spouses, because that's where two would come in, because many of the other individuals, some have been able to receive Medicaid because they had a dependent child receiving Medicaid, and they could also participate because the child was participating. So that's why I'm showing the figures for a household of one or a household two, because this is the larger group of either individuals or married people that will potentially be brought into the program. The other thing I would like to mention about it is some people that have not been able to participate in the Affordable Care Act because of the disability requirement being removed will be able to participate in Medicaid, because the Affordable Care Act requires a minimum income for the 2023 figure. An individual has to have a minimum annual income of $13,590 a year. So those that have not been able to participate in the Affordable Care Act, whatever their income level is, as long as they meet the 133% of poverty, would be able to participate in Medicaid. So the next slide, it just breaks down the numbers into the first year and the second year of implementation about how many we anticipate. Approximately 1/2 of the beneficiaries in year one would be converted to full Medicaid electronically. The state can convert those individuals because of information that's already in the case management system. They can be converted without, and we already have their income verified, without having to actually do an initial application. About 12 months out from that date, then of course, we would have to review, there would be like an annual review which is required. So we can expect on average about 418 additional Medicaid applications per month if you project it over 12 months for the first year. We are already averaging 457 a month now. So that would put our monthly Medicaid application total on a projection at about 875 applications a month. So we're getting close to doubling the amount based on these figures, or the number of applications. The next slide, you saw this last month, but I thought it was still appropriate. This shows the total staffing needs for full implementation once everything is in place and we have additional cases that have to be reviewed. This is what we're projecting based on these numbers. And like for ongoing maintenance of the case, based on the number of ongoing cases we would add in Medicaid, with 20 being added to the ongoing caseworkers we already have now, and we have about 5 or 6 positions in adult Medicaid that carry an ongoing caseload now, the workers would have about 635 cases each that they would be responsible for managing. And then
Hold up.
I'm sorry.
Did you say a worker?
Per
would ha-
worker, 635.
635
They would not all have.
per
to-
worker?
Well, yeah, they would not all have to be reviewed that many each month. That's what would be reviewed over a 12-month period.
Oh, okay.
Right,
All right.
right. That would be their caseload that they would, because they're not all gonna come due for review at the same time.
Mr. Chair, I have a question.
Sure.
Mr. Averett,
Yes,
on the intake, when you're looking at the 10 income maintenance caseworkers, are you saying, are they budgeted or not budgeted?
then they were not budgeted in this year's
Okay.
budget.
Thank
They
you.
were not. That's correct. These would be in addition to existing staff we already have. Okay. So we have.
Brian?
Yes.
And just to kind of piggyback on that, the state has given us startup money to be able to hire these positions. Started in May, is that correct, Brian?
That's when, yes, and they're on this next slide.
Okay, all right.
The initial, so we have written up an initial request for 10 income maintenance caseworker twos and 2 income maintenance supervisor twos. Ms. Rochelle has forwarded that to the county manager. That request, we've made that request because this is a mid-budget year, or not mid, we're not mid-year yet, but approaching that. We need to get ahead of this so we can start bringing the staff in that can assist with the applications. And the time is now, of course, to do that. So those that we are able to bring in that already have Medicaid experience can go through the basic training that they have to have and bring them up to speed. And then those that have to be trained, we're going to have some, of course, that will have to train ground up in Medicaid policy. So the figures Ms. Rochelle is referring to, the first figure is the amount we received, the county has received for unwinding and Medicaid expansion. And then the second figure at the bottom is the projected monthly amount. That would not start, so if my understanding is if Medicaid expansion is implemented January 1, then that amount would start with the first month of implementation and continue on a monthly basis after that.
So although it's not been budgeted for, we do have that money that the state has provided for us to hire extra staff and equipment or computers, whatever else that we need.
Okay, that's good.
How long does it take to get a staffer ready? Because I understand that there is a delay in the time, once you hire someone.
Well, initially, the initial training could take 6 to 8 weeks.
6 to 8 weeks.
6 to 8 weeks, the initial training.
Almost 2
People,
months.
and then those that have prior experience, it might not take 6 to 8
Right.
weeks to get them started. But somebody that's learning the policy, that's new to the policy, it's going to take longer beyond that to get them comfortable and working in the position and applying the policy.
So you guys took 2 months to get them actually going.
And we like, generally by 3 months, prior to 3 months, they'll start getting cases, but at the 3-month mark, if they have not worked previously in a DSS in the program that we're hiring them in, they would start getting a heavier caseload at 3 months, because by then they should have mastered enough to start actually producing not what a seasoned worker would produce, but what would be expected of a new employee.
At one point, there was a course of some work provided by Pitt Community College.
Yes.
Do you get
We are.
referrals from them?
Yes, we are getting applications, and we are hiring people that have completed that program. So somebody that's completed that program, that does give them exposure to the case management system. There are 2 courses. One is an introductory course, and then one is mainly case management and using the case management system. And so it is beneficial if they come in with that, if they haven't worked in the DSS before in the caseworker position, yes.
Because they get exposed to the system,
Yes,
right?
that's correct.
Okay.
That's correct.
I was just wondering if that was still happening.
Yes, it is.
Thank you.
Any other questions for Brian?
Just, Brian, the longer that this is being held up to be voted on, what happens to those folks who are waiting in the wings for their Medicaid?
Well, it just delays when they're going to be able to have access, and if somebody has ongoing needs now, it's just putting it further, the access further away from them being able to get treatment.
All right. Thank you, Brian.
Thank you.
Next, we have the Deputy Director's report.
Yeah, sure. All right.
Good afternoon, everyone. Feel really short when I come behind this podium.
Isn't there a little step stool down there?
Nah, but I'll stand on my tiptoes. It's nice to meet you all. I'm Nikki Mears, and I have the privilege of being here and being the Deputy Director. I've been here roughly a month, started the middle of August here. But coming back to Pitt County was much like coming home, because I did work here for almost 10 years before. I worked in the foster care unit and was a foster care social worker and worked with our LINKS program with our young adults aging out of the foster care system. I have a huge passion in my heart for young adults aging out into the system, and really want to be able to influence the systems that touch those children and those young adults, and how we can best serve them to have them set up to step into the world successfully. I have history in 3 other counties besides here, so my entire career since I graduated college has been in social work. I've done work in child welfare, pretty much every program in child welfare, and I've managed all of the adult services programs in another county as well. So I'm excited. Each county does some things slightly different, and there's always things you can pull from that are positive and room for growth from each county, and I hope that I can bring some of my experiences of the positive things that I've seen along the way and influence some things here. What I've noticed since I've been here is we have got a team of very hard and dedicated working people. I have watched these staff go above and beyond time and time again in just my observations, and so I appreciate the effort and the energy that each one of them is putting forth into doing the work that they do. The areas where I see that we need some support have a lot to do with staffing, and that's probably the number one thing. When you have significant vacancies across multiple program areas, it's hard to get everything done that needs to be done, and to get it done well, because you're trying to get it done quickly. And staffing is a problem across the state. It's something that every single county is experiencing right now. Earlier today, I was talking with some of our leaders and our director, and just talking about ways that we can be creative around staff. And maybe if we can't find enough social workers, could we look at some more administrative support to help lighten the load on people a little bit? And just how creative can we be with finding social workers and staff in all areas where we need that? And highly trained people, because the decisions and the work that is done here is very important, and it's life-changing for generations to come. So having highly trained and skilled people to go out and do that work is a priority for me and will always be a priority for me. That also is something because having a lot of vacancies means a lot of new staff are going to come in. So us developing a plan for training and addressing those needs of how do we do that when caseloads are high and things are high, you got to prioritize a bunch of things. So just figuring out the best way to do that. And so those are my biggest things from just being here and observing how we can grow and how we can do things. There's been lots of plans and goals put in place over time before I came. I've reviewed those. There's been a lot of progress on those. So there's a lot of positive movement in the right direction. And my hope is here that I can just come and help facilitate even more positive movement in the right direction. If there's specific questions that the board has for me ever now or in the future, if you just let me know what those things are, I'm happy to dig those numbers up. I probably can't spark out numbers to you today without pulling some stuff up and looking at them. I'm just not as familiar where I need to be, here yet, but I will get there. But, whatever questions you have, however I can help answer your questions so that you can make the best decisions as our board, and that I can support you all in supporting us as we move forward, I'm happy to.
You been here how long?
Well, I've been here since August 14th this time, but I almost had 10 years before. And I've been in the field of social work for about 20 years.
So if I said welcome home, you feel like it?
It does feel like home. I actually went and met the person in my old office and said, "Hi, this is really my office," and I'll always refer to it as my office. But yes, it does feel like coming home. A lot of the leaders that are here now, we were little babies in the field together, when we started out in our careers. And so I'm excited to get to partner with them and throw our ideas together and really make a difference in the lives of people that we serve.
All right.
Welcome, Nikki.
Welcome,
Thank you.
Nikki. Thank you.
Thank you.
You're welcome.
All right, now we have the director's report.
So at the end of the month, Nikki and I are going for a training. It's personnel and professional development. I don't have the complete agenda yet, but there are going to be workshops on balancing the rights within the workplace, EEOC, media, public relations, and creating great workplaces. So we're hoping that we'll gather some really good information to bring back. And then I will be, along with others, manning the DSS booth at the Pitt County Fair on Friday from 4 to 7. So if you're there, stop by and see us. But I wanted to have a presence there just so people understand that we're there to help. We're going to have people from all areas be able to come. So if somebody has questions or they want to fill out an application for something or just learn more, that we're there to be able to provide that to them. So looking forward to that. I've never been to the Pitt County Fair before. So it'll be a learning
We
experience.
hope you get to have some fun.
Yeah. That's what I'm hoping.
You say you're gonna be there from 4 to when?
7 on Friday night. I picked a good time, Miss Mary, right?
Yeah, that's when the crowd's gonna be there.
So that's it for my report.
All right, thank you. At this time, we'll have board member comments.
Everybody look this way. I'd like to say that it is nice to know what social service does. It is a service that is provided by your government that help families, people, progress, become healthy, and move forward. But it requires your assistance and work. So let's continue to work together and move forward.
Thank you.
I don't have any.
I do not have anything. Thank you.
I would just like to welcome the new hires. I know, Brian, I think you're starting to get quite a different group of folks from different counties. I've heard Hertford and Bertie over the last couple of months, so that's a good thing. And hopefully that trend to continue as we try to staff up to meet our community needs. All right, this time we're going to go into closed session.
Don't we have a statement?
North Carolina General Statute 143-318.11 regarding closed sessions. Section A, permitted purposes. It is the policy of the state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required. Also, number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state or of the United States, or not considered a public record with the meaning of Chapter 132 of the General Statutes.
Thank you.
I'll do it. I'll make a motion that we adjourn our meeting today.
I second.
Thank you.
Thank you.